Hello, welcome back. This is Talk ADHD, episode 12. And as promised and as asked for multiple times, this is an episode that's really important because we are really digging into the connections between ADHD and what it means to be perimenopausal, going through the menopause, and everything in between. And as ever on Talk ADHD, we like to talk to those who know, and that's certainly not me. Now, you'll notice Andrew can't be with us today, so I am joined by Diane Porterville-Born, who is a menopause nurse practitioner who runs private menopause services through her company, Born to Care. Diane, thank you so very much for joining us. It's fantastic of you to give up your time. Would you like to let people know anything about yourself before we begin?
I've been nursing a long time. I live in Worcestershire. I've been nursing for about 35 years now. I've been a nurse practitioner for about 20 years. And I run private menopause services predominantly online, and I write training about menopause as well and deliver it to the NHS as well as different organisations.
Fantastic. So straight away, a wealth of experience and knowledge, which is what we need and what our listeners are craving. So let's dig straight into this, because not everyone is talking about these two topics in tandem, menopause and ADHD. So can you maybe share how you first started to connect menopause with the wider topic of neurodiversity and neurodivergent conditions, and in particular ADHD and autism, within your professional practice?
Absolutely. It wouldn't be the two that you'd immediately be putting together, but it really stems from my own personal experiences of family members being diagnosed with autism and ADHD. So maybe about 3 or 4 years ago, I had to do an awful lot of research and reading to get my head around how to support people and how to inform people of what the symptoms were, how to support family members, and really to educate myself as well. So I started to learn an awful lot about neurodiversity. So I was doing consultations, supporting people with their menopausal symptoms. And I was realising that all these ladies that I was seeing that were complaining of lots of different issues to do with their menopause, not coping, not sleeping very well. But I think the one thing that triggered it was that people were saying that when they're going into work or when they're going out for the evening with their friends, they really don't want to go out. They're struggling with their emotional health, and they're putting on this, and I say in inverted commas, this act, this pretense to actually physically and look and act normal, that they're calm, cool, collected. They understand what I can cope. I can deal with anything that work throws at me, smile.
Yeah.
They're just not feeling it at all. And I thought I saw this over again, and I thought, okay, that's fine. And then it suddenly dawned on me the one day, this one lady was saying that she sort of like has to put on this mask to show everybody at work that she's coping, and that, otherwise she'd be on being on report and managers. And I thought, well, hang on a minute. If this is what we class as neurotypical women that without a neurodivergency are coping with them, what are neurodiverse women doing? How are they coping? And for me, that was really a rather light bulb moment, because it was like, well, wow, this is massive. That these are women that are normally coping with life, but are having to pretend to the world that they can cope with their menopausal symptoms when they clearly can't cope very well. So I thought, well, how are women with neurodiversity, such as autism and ADHD and dyslexia, how are they coping with their menopausal symptoms? How are they going into work? How are they coping in the workplace? How are they managing to function with society and home life? And for me, it was a little bit of a revelation that I thought, wow, this is something that I need to focus on and to be aware, so I can support women going through the menopause.
Wow. So yeah, you mentioned that light bulb moment, and did you start to then join the dots, I suppose, between sort of the implications for treatment of menopause as well when women were neurodivergent?
Yeah. I mean, obviously, I prescribe HRT probably most of the time. It's not what everybody wants or everybody needs, but HRT I know can make a significant difference. So as far as joining the dots are concerned, it was the fact that women that were on HRT coped a lot better with all of their menopausal symptoms. But women, I was starting to see more and more women that had a diagnosis of neurodiversity, of autism and ADHD. And I was able to support them. So I was able to identify and say, I'm going to give you a bit of extra support. I understand the importance of hormones and how they work in the brain. I was speaking to different ADHD foundations, providing training for them. And we were working out that with the women that were diagnosed with having ADHD, we could adjust, or they would adjust their ADHD medications if I was prescribing HRT to them. So the two
Right.
are currently together. So estrogen was amazing for most women. And then ADHD medications for some women, they were actually able to reduce their ADHD medications because they realised that they didn't need quite as much as they did, because what they actually did need more than anything was estrogen. So popping them up with estrogen and then reassessing how much they actually needed of their ADHD medications. So you could see how the two would work very well together.
Yeah, and it's interesting when we first sort of covered this topic, and we had Sarah and Elaine on, we spoke about sort of the endocrine cycle, and we spoke about the regular sort of female cycle, and this period where estrogen drops anyway is challenging for women, particularly in terms of dopamine creation and the amount of dopamine that's then available. So it makes perfect sense that you see those links. It's fascinating, though, that in trying to sort this podcast out, it still doesn't seem to be something that everyone who understands menopause is seeing the links between. Do you think there's a reason for that?
I think it's an overall lack of awareness about anything to do with neurodiversity, everything in healthcare. And because my eyes have been well and truly opened because of, one, understanding it myself and supporting family members that are experiencing it, I can see through their eyes, in a way, that
Right.
health systems aren't catering to support them, to meet their needs. Health services are chaotic, crazy. You can't get through to anybody, whether you want a face-to-face appointment with somebody, you want to speak to somebody on the phone, you want to send a text. They're trying, but there's just the services aren't there to enable people with a divergency such as autism or ADHD to actually say, I feel comfortable and I feel more relaxed and I feel less stressed and I feel able to cope better in this particular environment in health services. There's just a huge lack of awareness about the needs of people with neurodiversities. And so this is where I come into it. And I've done some teaching with nurses fairly recently. And I was talking about neurodiversity in the menopause, and there were lots and lots of very blank faces. And I was explaining the importance of how many women are going into the surgery for sleep disorders, mood disorders, really, really low, not coping. Have you considered that, one, they're menopausal, and two, could there be other underlying causes to their mental health? Instead of just people being given labels of, having mental health and anxiety, it's getting to the root cause of why they have this. I've explained to you before that there's some research that's saying there's about 75% of women are undiagnosed ADHD. And when I'm 53, I had to think about it then, I'm 53. So when I was at school, there was no such thing as girls having, any ADHD or autism. It was very, very rare that it was ever discussed. It was just stereotypical naughty schoolboy in the classroom. There was always one in the school or one in the classroom. And I'm not saying this to upset people, but that was just sort of the way it was portrayed. But you didn't see girls. Girls didn't have something like that. It wasn't ever discussed, and there certainly wasn't anything that was ever done about it. But of course it was there. So all these girls that was never picked up at school or college, suddenly, because menopause is a life transition, it's a change. Puberty is one, and menopause is another. This complete life transformation. Suddenly, hormones are gone into overdrive. They're falling, they're fluctuating. So where women would have been coping particularly okay because they developed their own coping strategies, suddenly everything literally just falls apart. You can't spin those plates anymore, and things crash down. And health professionals need to be aware that this is how the menopause will impact women with potential neurodiversity, undiagnosed neurodiversity. And that's what we need to be looking at and focusing on.
Yeah, and it's interesting. What I'm just reflecting on my own wife's experience and the experience of women that I've spoken to in our WhatsApp community and women I've supported. So we often talk about rejection sensitive dysphoria and emotional dysregulation as being very, very symptomatic of ADHD and also impacting autism as well. But I remember very early on, years ago, when my wife was questioning, is this menopause? What's going on? That phrase, it felt like the wheels had fallen off. We'd suddenly gone from sharp, brilliant mental acuity, keeping everything together, to suddenly nothing was working, nothing felt right. There was lots of emotions seemingly out of nowhere. But I wonder now, through the women you're seeing, and you mentioned particularly the difference between undiagnosed and diagnosed, how many women struggle to take that to a GP and to explain why their emotions may seem sort of exponentially more extreme than perhaps other women that are saying, I think it may be menopause. Do you think that, you mentioned about the difficulty explaining this to other healthcare professionals. Do you think that's presenting problems because of that lack of understanding?
Yeah, it's got to. There's no other way you can avoid that question. It's got to, because the whole thing with menopause, I mean, obviously over the last few years, there's been an awful lot of awareness being raised with it. But when I first started teaching about menopause and seeing women through the menopause, this was years ago. It just wasn't in a situation we are now. People hadn't got a clue. Health professionals had very little understanding at all.
Right.
And it's had very little understanding. So I really was trying to inform them and educate them. So I think what's important as it stands at the moment is, if you think it is impacting you, you unfortunately have to be the person that drives forward. You're the one that said, I think there's some problems here. I've done my own homework. I've done my own research. I've got this, and this. Could it be this? And so by people educating themselves, I know lots to educate their healthcare professionals when it comes to menopause, that's not the way it should be. But unfortunately, that's just life. But I think with something as so specialist and so personal as the neurodiversity versus the menopause and how it impacts you, then I think it's important that you do your homework and you speak to health professionals yourself if you can. If you can.
If you got, do you recommend then the ladies maybe keep? I mean, my wife keeps a diary every month of her cycle. I'm sure she won't. Yeah, but that's for her to notice the fluctuations and sort of to keep track of, because she's on HRT. What's the estrogen doing? What's the progesterone doing? Where are things? Do you think that's a useful thing to be able to then take to a doctor in the early stages and say, look, this is everything. This is like my own diary of symptoms, and I think it could be this.
Yeah, I think in a way that's a very good idea, but to simplify that a little bit, what I probably would say is to talk to the people that you live with and the people that are closest to you and get their understanding about what's going on, because I see so many women think that they're dealing with things very, very well. And I said, I think you need to speak to your husband or your partner or your children, and you get a very different version of events.
Right.
And it's about being truthful without being hurtful. But here is very important. So it's about writing down your main symptoms. So by talking to people that are close to you, you can list maybe, say, the first 8 symptoms that are impacting upon you, whether it's sleep, whether it's anxiety, the fact that your mood has crashed. Is it that you're really angry? Is it that you're very irritable? Is it the fact that you've got muscular aches and pains, that you just can't form a sentence together? So write down a list of symptoms and then plot those symptoms through your menstrual cycle. So most people that have a neurodiversity, it will just be exacerbated, get worse just before your period, but you will always have these issues there. As hormones fluctuate just before your period starts, it's called the luteal phase of your cycle, the last 10 days. You may find that your symptoms will worsen at that point, but you will always have coping issues, and obviously the issues are there because it's being caused by your neurodiversity rather than anything else. But your hormonal functions will make it a million times worse.
So, as a clinician, then in your professional practice, how do you approach the treatment of these menopausal symptoms differently? If you recognise that there's potentially neurodivergence there, does it change the way you approach it?
No, not really, because I provide people with the same advice and treatment no matter what. But I think if I know that somebody's definitely got a diagnosis of neurodiversity, so somebody books an appointment, they tell me they're autistic or they've got ADHD, from my point of view, that makes things a lot easier because I understand where I need to give them additional support, or I will ask, how can I help you the most? What can I do to make this consultation as comfortable and relaxed so that you get the most out of it? And I always give people extra time. So somebody does your autism, I say, we will give you extra time. You just need to tell me. So those women that have a diagnosis actually find it's a lot easier because I understand where they're coming from and the additional support they need. So explanation, extra time.
Yeah.
It might be that there's some of the sensory issues that maybe they need to keep the lights down in the room, that they need a quieter space, that they can't look at the camera because I do lots of online consultations. So they don't have to physically stare at me. The last thing I want to do is feel uncomfortable. I know that actually just stare down at the floor or stare into another corner, and that's what makes them comfortable. I have no problem with that whatsoever. So it's whatever is for you, because at the end of the day, it's about reducing your anxieties and making you feel better, so that I can help you, prescribe you the right medication, and
Gotcha.
and explain the symptoms of what they mean to you.
That makes perfect sense, and that approach to, everyone's an individual. It's that important thing, isn't it? But meeting their individual needs within a consultation is so important. So sort of following on, in your experience, do you think there are any common misconceptions about menopause, or do you think neurodivergent women particularly have misconceptions about it, or not? Do you think their understanding of what menopause or perimenopause is the same, but maybe it's the recognition of how it may affect them that they don't have yet?
I think that's more the issue, is the fact that neurodivergent women won't understand the impact menopause has until everything starts to fall apart. So from my point of view, it's reaching out to women before they hit perimenopause or in the very, very, very early stages of it to go, this is what you need to be aware of. If you start to feel the wheels falling off, you start to feel that you can't cope like you used to, and there's no other explanation, what's going on? Is it the fact that it's hormones? And to not leave it, but to get that specialist help sooner rather than later, because what you don't want is to be picking somebody up off the floor. You want to support people when they're just having a little bit of a wobble rather than when they've crumbled in front of you, and that's going to take a good while. From a mental health perspective, that's the last thing that we want.
Yeah, of course.
My worry is how many women are out there that are really, really struggling with their menopausal symptoms, not knowing that they have an undiagnosed neurodivergency, such as particularly ADHD, and struggling and they just don't.
Yeah, and that's a really interesting point as well. It's that not knowing, isn't it? Like I say, my wife hadn't considered ADHD when we were considering menopause. It came later, when that penny dropped for us. And you're right, it did change things, and it does change things, and it's important to point people in the right direction. I'm interested. There's a phrase you used when we spoke about joining the dots between these various conditions, right? And menopause and ADHD. Have you got any examples of how that sort of presented in practice that made you kind of with someone say, wait a minute, are you sure this is what you think it is?
Yeah, I mean, I see quite a few, and now I've got even more awareness of it. It's, I can actually think back about quite a few people I have seen. So I'm thinking, when I see them again, I know I'm going to support them slightly differently because I've got more awareness now. And even thinking about it, I can think that I'm pretty certain that I will be discussing elements of this with them because I think it's important. But in clinical practice, I've seen people that don't have diagnosis of anything. I'm not an ADHD or a neurodivergent expert at all. I specialise in menopause, but through my own experience, but through my own clinical practice and seeing it for myself and identifying how menopause affects neurodivergent women and hormones and mental health, I've started to put the links together. So there were a few ladies I've seen over the last 12 months in particular that I can reflect on. So one lady was perimenopausal, and I saw her about a year ago. She had some mental health problems, but nothing more than I would be expecting. I suppose the difference was that she had some significant menopausal symptoms. So I always assess people. I do like an assessment of their symptoms and I categorise them. So some women have very significant menopausal symptoms and I'm looking at it thinking, these are really, really life-changing symptoms they've got. We need to see what's going on here. Other people have very mild symptoms that doesn't particularly bother them, but some women have got significant ones. This lady had very significant symptoms: extreme tiredness, mood swings, muscular aches and pains, brain fog, headaches, just really not coping at all. And when I started to talk to her about it, she'd been on antidepressants for a long time and they'd upped her antidepressants. I then started to question her previous experiences because I'm thinking she's obviously got some hormonal fluctuation issues here because she was very sensitive at certain times of her cycle. It got worse at certain times of her cycle. So I thought she's obviously got some sensitivity to some of the hormones. So I said, any premenstrual tension when you were a teenager? Well, a little bit. But she told me that she had postnatal depression. So postnatal indicated to me that she's more sensitive to hormonal changes. And so I gave her some HRT and I said to her, have you looked into premenstrual dysphoric disorder, which is like an extreme form of premenstrual syndrome? So that normally affects people towards the latter part of their cycle. So the last 10 to 14 days of their menstrual cycle before the period started.
Right.
And she said, well, yes, I'll look into it. I'm like, okay, fair enough. So I just put it in her notes. I reviewed her 3 months later after prescribing her some hormone replacement therapy, and she was coping really well. And her husband was with her for the consultation. He said, I've got a different wife now. He said, I can't believe the difference in my wife is unbelievable. He said, I just can't believe how different she is. And she said, I feel amazing. Review again 3 to 6 months later, and this was a consultation I had in the last couple of months, and it was a different person in a different way. She was not coping. Menopausal symptoms were really significant. Her estrogen levels had steadily been increasing. They weren't too high, they weren't that low, they were just good. And I thought, well, all the blood work seems to be looking really good, so why are you really struggling with your mental health in particular? She was very angry, very moody. Her husband said, I don't know what to do anymore, and he ended up walking out. And we just had a really good chat, because I thought at least then I could talk to her on a one-to-one. So what's going on? I said, I just feel that the wheels have fallen off everything. So with these, sometimes with situations like this, if suddenly there's things have been working and they haven't, there's generally a cause to it, and the cause generally is a life event. So are you on the threat of losing your job? You're having issues with children, something just spiked that increase in cortisol, your stress hormone levels, and that's generally the driving force behind it. It rarely affects their levels of estrogen in the blood, but it induces symptoms. And mom had gone into hospital, and she'd been trying to sort out things with her dad and things like this. So I thought, well, that's probably what it is. So I didn't pursue the PMDD section of things, but I thought something's not right here. The issues have been going on for some time, and then she started to divulge more about, well, actually, I've been masking for ages. And these were her words. I've been masking all of my life, Diane. And she just burst into tears, and she said, people don't know. They don't know the struggle that I've been having. Everyone thinks I'm the life and soul of the party, but they've no idea what's going on inside my head. And I thought, whoa, okay. And so I then started to think, well, possibly this is maybe neurodiversity here, neurodivergence. So I just asked one question, and I said, do any of your children or siblings have autism, ADHD, or a diagnosed neurodiversity? And she smiled. Well, yeah, she said, my son's autistic. She says, my daughter, she said, we're waiting to get a diagnosis. She's had some assessments done. And I went, oh, right, okay. And I started to grin a little bit at this point. I thought, oh, and she said, why do you say that? And I said, do you see any similarities between you and your children? And she laughed, and she said, actually, she said, I am so much like my daughter, it's unreal. She said, it's like our little club. And my husband just doesn't understand us. It's our little club, because she said, we understand each other. And I said, look, I'm not here to say anything other than I would be suggesting that you need to look into this a little bit more. There's a chance that you could have some form of a neurodivergence, because there's such a high incidence, if your children have been diagnosed, that you could as well. I said, I'm not here to make any diagnosis at all, but give you advice and links to get a proper formal diagnosis, if that is what you want to do. And she was crying, and she said, I explained a little bit more about neurodiversity. I went through how it works in the brain, the hormones, and she just said, Diane, that is me. That's what you've just said. That is me. That could be written for me. And it was, for me, it was like, whoa, okay. And she said, I am going to go and get an assessment done. And she contacted me just a few weeks ago to say that she'd been to see her GP, and the GP, they'd actually looked at some ADHD information online, her and her husband, and they'd gone through it all. And she said, I recognised myself in all of it. She said it was really quite, I had no idea how significant my symptoms were until I actually looked on an official website and realised that I was very, very symptomatic. I had everything that was on there. And for my husband to see that as well was quite an eye-opener for him. And then my GPs then referred me to get an official diagnosis on the NHS.
What was it then? I mean, you obviously spotted that, which is fantastic. But what do you think was the reason that it took that time from coming to you initially, starting treatment, seeming to make that massive improvement, and then that going downhill again? Because it sounds to me like something we've discussed on this podcast before, about when people start any medication, that there's almost a a honeymoon period, because there's something new in our body's getting used to it, and if it makes a positive change, it feels life-changing until we then sort of level out and get used to that. But then other, I don't want to call them issues, but other things suddenly start to present differently. Does that sound about right? That's what happened.
That's exactly what it is. If you think the way I do my consultations, and again, I'm just saying, when I say a normal consultation, it means my run-of-the-mill CP, prescribed for them, no issues, no problems, we've got them sorted, their blood levels are high, their symptoms are reduced to very low, they're coping with life very, very well. Perfect. Then there are other people that I see that it's not quite as clear-cut as that. A whole mix of different things. But some people that have very significant mental health symptoms to start with, these are the ones I'm thinking, okay. And then I talk to them about their symptoms and how it's impacting their quality of life. So then I'm looking at their blood. So I'm already thinking they've got a lot of mental health issues here. Very, very symptomatic. Their bloods are telling me their estrogen levels, now I've prescribed for them, their estrogen, their brains are filled with lovely estrogen. So that's helping it boost their dopamine and serotonin levels. Brilliant, great. That's where they're coping. So what is it that suddenly they don't feel that they're coping? And so for this one particular lady, it was the incident of her mum going into hospital.
Right.
It was that spike then of cortisol that just completely altered her brain chemistry. And probably depleted. I mean, like I said, I'm not an expert with all of this, but I would imagine it just knocked her dopamine levels down. And that's why suddenly she felt she was starting to crash again. And so having that realization, and for her, and we were explaining that this sounds like this is what it could be. She could completely relate to it far more than I could, because she was like, that is me.
Yeah.
Feel. And for her, that was the most important thing for me, because I'm directed by her and saying, if you want to get a formal diagnosis, that is your choice. You don't have to. But
that makes perfect sense. Now, there is a phrase we talk about a lot with ADHD and neurodivergent about shared care with GPs, right? So we talk about private diagnosis of ADHD being referred back to a GP for a shared care agreement. So that's not just for prescription of medication, but it's for everything else as well. Now, would that be something that, let's say, if you work with Sarah from Divergence, for example, so let's take that woman as an example, you say, if you think that's a good idea, go seek a diagnosis. She goes and sees, for example, Sarah, gets diagnosed, starts ADHD medication. Would it be your best case or your expectation that there is then a communication between you and Sarah, so that you know exactly what she's being titrated on, exactly what medication, what the expectations are, so that you can then adjust or know what you're doing? And which way round do you think is most effective? Is it HRT first, then ADHD meds, or the other way round?
Well, if somebody's on ADHD to have a diagnosis, then it's more straightforward for me. When I've spoken and when I've supported women with ADHD before, and I've spoken to health professionals who specialise in ADHD, all they need to know from me is the fact that, am I prescribing HRT for them? Then they will adjust the medications depending on their level of symptoms.
Right.
So it's easier for me to start that process by getting somebody on HRT, because if nothing else, the root cause of how they're feeling, ADHD medication is certainly going to make a significant improvement. But if they're lacking in dopamine, for example, or certainly they're lacking in estrogen, then it's a case of replacing that estrogen. And then you're seeing somebody from a slightly different perspective, because suddenly their estrogen or their low levels of estrogen have been replaced. Suddenly they've got their brains working again, they've got more energy, more motivation, more enthusiasm, more organisation skills. because they needed estrogen. It's better from my perspective to address that first. But definitely working with healthcare professionals, that's something I'd like to do. I have found a difficulty with that, with shared care as a whole, is quite challenging. But that will be something I would speak to ADHD health professionals about, and see how we could get that to work together. I wouldn't have any problem at all. It's just it's all set up.
Well, and it makes perfect sense, doesn't it, that there's those open channels, because it benefits, you know, all the healthcare professionals and the people in the middle of it who are seeking help. So yeah. So I'm just thinking about this. Have you got any advice then for neurodivergent women, ADHD, autistic women, who are either approaching or who are experiencing sort of perimenopause and menopause, who feel they're not being either understood or not being properly treated? Is there?
Yeah, well, I just think really it's a case of you doing your own homework and thinking, am I getting the support I need from my healthcare professionals? Seeking advice from healthcare professionals is challenging for everybody. And this is where I really think that the service is letting itself down, supporting people with neurodiversities, because, you know, trying to get through on the phone, trying to get a face-to-face appointment, whatever suits your needs is difficult for everybody, but let alone somebody that maybe struggles with social interactions and has like to light and noise and chaos and things like this. So there's a lot that we can do, but I will be suggesting that you would be doing your own homework to be as articulate as you could possibly be, to write down a list of questions, to write down your symptoms, and write down the kind of support that you need from them. So you've got everything in written down in front of you. Maybe take a friend with you, so that you can speak to healthcare professionals to get the point across, and maybe find that there's a health professional there at your surgery that you have a better rapport with, or you feel more comfortable with. Menopause might not be their specialist subject, but you feel listened to and supported. And at the end of the day, that's probably the most important thing, that people are taking on board what you're saying and understanding you.
Yeah, absolutely. And that's all people want, isn't it? That feeling heard and feeling well treated. So you've joined dots and you continue to join dots. Now, when we sort of spoke before the podcast, you mentioned that you're already involved with research, and you've been sort of working with various people. Have you got anything you can share about some of the research that you've been looking in or assisting with, or sort of reading yourself into this? And
I've probably for about 4 years I've been reading about autism and ADHD during the menopause, and there's one particular article I read by Dr. Rachel Mosley. She's at Bournemouth University. I was reading it about midnight one night in bed, as you do, and I was reading an amazing article that she'd written about autism and the menopause. I thought, fantastic. And the conclusion was that there is no research on it. And I was just like, what? And I actually emailed her at midnight to go, I'd love to get involved with this. I'd love to know more about this. And I have been in touch with her quite a few times. There are quite a few other people, researchers, that are doing some work into neurodiversity and the menopause as well. And, you know, but it's one of those things that I've done my own research. I've done my own studies. I'm trying to work out in my head what happens with women during the menopause. You know, how do the hormonal fluctuations impact neurodiverse women more than somebody that doesn't have a neurodiversity? And it's more to do with the fluctuation of the hormones and how we individually deal with them. It's like, you know, girls at school, you know, when their periods are about to be due and they're in that particular stage just before their periods, they become a lot more sensitive to light and sensitivity and noise and chaos. But that's because their hormones are fluctuating, and this happens during the menopause as well. So it's about the fluctuations of them, and it's about so sensitive to the fluctuations where other people, it wouldn't even bother them. They might feel a little bit low at certain times of the month, but hey ho, you brush it off and you're fine. But it's not like that for everybody. So for health professionals, it's about understanding that it impacts women very, very differently, and that the slight fluctuations of hormones can have such an impact on physical, but certainly mental health and well-being, and coping with work and life.
And I almost want to go back to a question I think I asked you earlier, but I'm joining my own dots here. Do you think there are particular traits, and particularly now I'm thinking of ADHD, that healthcare professionals perhaps don't understand, A, how commonly they present, and B, how they impact those reactions at these different times of the cycle and during menopause? And I'm thinking again of those things like emotional dysregulation or rejection sensitive dysphoria. But I think the other one is, does it impact when we're that discombobulated on things like our executive function as well?
Yeah, I mean, at the end of the day, when hormones are fluctuating, it affects all of these symptoms. There are over 40 symptoms of the menopause. Brain fog, confidence, anxiety are all impacted for anybody during the menopause. But if you've got more significant fluctuations, or you're just far more sensitive to the fluctuations, it's like women with migraines, very, very sensitive to hormonal fluctuations. And these are another group of women that need a lot of support with their menopausal symptoms, because the effects can be horrendous. So it's about, having that understanding that this is how it will impact you, and just seeing what we can do, tweaking HRT, giving that additional support, and raising awareness of the fact that if there's a possibility you do have a neurodivergence, that, having these key issues, that think about how the symptoms will impact you during that particular time of your menstrual cycle, and are there patterns to it, will just make you realise that maybe you do need to get extra support, and thinking, what else can I do about it?
Well, that makes perfect sense, though, doesn't it? Okay, so let's look a bit forwards then. What changes do you hope to see in how medical community and other healthcare professionals are addressing the needs of neurodivergent individuals during the menopause?
Well, first of all, it's for healthcare settings to be neurodiverse friendly is the key to this. They do try with like quieter areas, but it's just, it's a very, and it doesn't particularly help as much as they're hoping it will. So it's about having a real awareness of it. I'm aware now that people with women that have got autism, or certainly children that have got autism, and how the noise, sensation, and lights, and all the different things around them can significantly impact their mental health and well-being. So if we take that into consideration, children, for example, coping in school, in a hospital setting, you can imagine going to the emergency department. It's chaos there. Yeah. And the fact is that it's a disorganized chaos. So, if women are displaying symptoms through the menopause of, they are overwhelmed, more overwhelmed than normal, more disorganized. Normally, some women with ADHD are sort of like high achievers, in meaning the fact that they overcompensate by being super organized, and then when the menopause, everything falls apart. So then they'll be completely and utterly overwhelmed. And it's a case that people think, well, why aren't you coping with it? So it's really how we can join the dots together to think of how we can support people during the menopause in all settings in healthcare. But the key to this is about teaching and education, because when I've spoken to people within organisations about menopause, neurodiversity, I don't talk a lot about it, but I certainly talk a bit about it. And I've had some amazing feedback from people. And I've only just started to talk about it within the hospital settings and to healthcare professionals, but they're sort of loss of awareness about it, really. And they don't really understand what I'm talking about and the relevance of it. So that shows that we just need to keep talking about it. And when I spoke recently to some healthcare professionals on menopause and neurodiversity, it was very much that they were sort of mouths open. They had no idea the impact that it could be having on the number of patients that they're seeing on a daily basis.
I mean, it's astonishing though that you're met with mouths open still, and surprise and a lack of awareness. But you're right. Conversations like this and professionals like yourself and ADHD professionals joining up, sharing the conversation, kind of highlighting that these things are linked. They have to be linked. There is one thing that you just mentioned that hadn't occurred to me here. You mentioned about overwhelm.
Yeah.
And I'm now thinking about my wife again. Is it conceivable, again, that we could see people displaying signs of burnout, but it could be caused by any number of things? It could be because of the stress of menopause and coping with those severity of symptoms, as well as dealing with it as a neurodivergent individual. And again, it's that, how does somebody go about dissecting that for themselves or explaining it, in your opinion?
I think it's the case that if there's enough thoughts there that it could be that they could have an undiagnosed neurodivergency, that they go down the right routes and look at the right websites and speak to the right people to then get proper diagnosis. Because what I don't want is people that are, if they do want to find out a bit more about it, that they're afraid to, or they're uncertain about it, or they don't know how to go about it, that they can go about it. And everything that I've ever possibly read to back this up is that people that have a diagnosis say it's the best thing they ever did, because that suddenly everything makes sense. And
We have answers
over and over again. And it's a case that often wondering all of your life that you've never particularly fitted in, nothing's never felt quite right, you've always felt a bit out of place with society or people or situations, that suddenly, wow, this is what it is, and I've never known anything about it. This is what ladies are telling me that have got the diagnosis. Now, or people that had a diagnosis, a few years ago, that have come to see me. And so really it's about how we can support those people, and just keep raising the awareness. That's, for me, it's about making sure that we understand the complexities that people face that do have neurodiversity. It's not everybody, but it's about most people will, and we have to accommodate our lifestyles, our societies, the way we do things. It shouldn't be for neurotypical people. We should be accommodating it for people with neurodiversity, because it will create such a wonderful environment for us all to live and work in.
Yeah, I agree.
That's what we need to get the message across, because it's going to be a more relaxed, calmer environment for us all, and with stress and anxiety affecting everybody very, very significantly these days. Surely that go.
No, yeah, it makes sense. Just a very quick question about some of the older population. There's something I see reported a lot, that ladies make it sort of all the way through perimenopause and have their menopause, and then somewhere between 6 and 18 months afterwards are still thinking, hold on, this still feels like menopause. I still feel like I'm struggling. And it's then that they start joining their dots of, is it ADHD, autism? Have you experienced that particularly? And again, do you think that goes back to that they've developed their ability to mask, perhaps, or to cover up those symptoms so well?
And it's absolutely, and it's often like life events that will happen, that sudden rush of, like, the death of a partner or a family member, that literally that's what's the catalyst here. And they've been coping and coping and coping, or putting such a brave face on, the old camouflaging,
Mm.
fool everybody, including themselves, that they're coping well, but they don't understand why. And so when these significant life events happen, redundancy is another
Mm.
one. Yeah, death of a family member. That's enough just to cause absolute, everything, literally everything will fall apart for anybody, but let alone somebody that has a neurodiversity that but undiagnosed, they don't understand why they're not coping as well. And you can imagine then how overwhelmed and low in mood you would be, because why aren't I coping as I normally do? Why can't I do this? Why can't I pull myself together kind of
Yeah.
attitude?
Yeah.
That you're trying, I always say, you're trying to walk up a mountain with a lorry strapped to your back. It's just, we
Yeah.
need to break you free of that and go, let's get this sorted out, and just make you feel better, either predominantly with HRT, but looking at how you can change things with your lifestyle as well to increase your own neurotransmitters to make you feel better, and working with ADHD, autism health professionals, so that people are getting the right diagnosis and the right support from the right organisations.
Sounds like a plan. Okay, I'm going to ask you one question, because obviously, we're talking about HRT a lot, and that is, the best thing, I think, in terms of treatment, isn't it, for most women? But for ladies in those early stages, or maybe who haven't accessed it yet, are there, should we say, more holistic things that you recommend? Are there basics? Because often we talk in ADHD about get your sleep right, get your diet right, get exercise as it means to you right, and these all help with mood regulation, dopamine. Is it a similar kind of an approach?
Absolutely. For people that I don't prescribe to, that can't take HRT or choose not to, I always say, well, it's not quite as straightforward as you have HRT and you don't need to do anything else in your life. It's a case that healthy lifestyle, positive mental attitudes, exercise, nutrition is key. And all of that will help with your mood, will help with your menopausal symptoms. For example, with alcohol, more likely to get hot flushes and night sweats. So it's about adjusting your lifestyle, losing weight, keeping your body mass index at a lower rate will reduce your risks of developing cancer and heart disease and everything else. So there's lots of things that you can do. But nutritional point for people that don't want to take HRT, particularly in the early stages, although I do have to say, if the sooner you start it, the better it's going to be for you, is the key.
Mm.
You could eat foods that are rich in phytoestrogens, so your soya-based products, your lentils, your fibre, your flax seeds, your seeds. They will help a bit, but nothing will work to the same extent as HRT.
Makes sense. Right, Diane, everything you've said has just been so insightful, and I've been listening to your answers, and I know there's a lot that we've been asked on the group this will be so useful for. Is there anything you would like to say by way of sort of a closing statement for you, whether it's advice for ladies or whether it's advice for clinicians or both? Before we close, what would you like to leave people thinking?
I think, first of all, the most important thing is, if you think you're going through the menopause, is to seek advice from reputable professional menopause services. It doesn't have to be private like what I provide, just reputable, recognised menopause that are either nurses or doctors that are trained in menopause. And be very cautious of certain things that you will read online and people that are not medically qualified. And then the other side of this is the fact that speak to people that have neurodiversity, such as yourself, or you suspect, and see with their symptoms, because having friendship bonds on and talking to people makes a huge difference. So it's about getting diagnosis by the right people and getting the support from the right people. And don't be afraid of HRT. It's safe and effective for virtually everybody, and you can take it long term as well. And it makes a massive difference.
Yeah, no, I can't disagree with that, because I've seen it. Diane, listen, thank you so much for your time. As ever, if you look in the show notes for this episode, you'll see links to Diane's services, and we'll try and link to some of maybe the symptoms that you mentioned, the 40 symptoms of menopause, so people can look at that in tandem with ADHD and autism as well. But for now, that has been an incredible conversation, and I really hope it's helped, although I get a funny feeling it won't be the last, because this is a conversation that's going to change, and new information will come out. But Diane, thank you so much for your time, and folks, we will see you next Thursday for another episode of Talk ADHD. But for now, thank you very much and goodbye.